everyone. I'm going to go ahead and share my screen. Okay, let's do this one. Okay, and if I can get some thumbs up that you can see that, I would really appreciate. Okay, great, already, wonderful. Okay, yeah, like Asher said, I am Jay Cangelosi, she, her, and I do have some extensive experience in EAP, as I noticed some of you in the audience might be familiar. So I saw some recognizable names there. Yeah, so let's just jump right in here. There we go. Okay. Yeah, like Asher said, I am the clinical development coordinator with Relief Mental Health. And first and foremost, I want to thank all of you here with NAIPA for inviting me to talk with you guys about mastering telehealth to foster connections, right? I do have previous experience earlier in my career working for an EAP. Like I said, I recognize some of you already in the audience there. So with that, my role was strictly remote at that time and was solely administered by either phone or video telecommunications. So that's kind of where that background came from. I'm also an introvert. And I mention that because that fact, coupled with the fact that I was never going to see anyone in person, actually required me to very quickly develop some strong skills in projecting my personality through technology, right? So that's why I now feel that I have somewhat of expertise providing information on telehealth counseling. So I do want to briefly share a little bit about Relief Mental Health. We are a leading outpatient provider of transcranial magnetic stimulation, or TMS, which has been FDA approved for the treatment of depression, OCD, anxious depression, smoking addiction. We also do provide psychedelics, Spravato, esketamine, which is the nasal spray, to treat treatment-resistant depression, as well as IV ketamine, which is approved to be administered in a few of our clinics. And then, of course, your standard med management and therapy services are offered. I also want to take a minute here briefly and acknowledge the fact that I fully understand the undertaking that attending today's session could be for some of you. I know you've already been in a meeting for about an hour already. You know, attending another 2 hours of a CEU session late in the morning could very easily have taken a lot of finagling for you to do. So I want to acknowledge that. I do realize that some of you might be carrying a lot of mental clutter with you today already, whether it was because you may have been running late this morning or already had a busy morning, and maybe you even still have a lot to do later this afternoon to finish out your week, right? So the first thing I actually want to do, and this might be a little bit of an unusual starting, but I do want to invite everybody to take a few minutes and do a bit of a mindfulness exercise with me, okay? This for the purposes of releasing any distractions that might be contributing to the mental clutter that could already be going on for you this morning, okay? So let's do this. Let's get settled comfortably in our chairs, right? Okay, relax your shoulders, stretch out your neck. Maybe you need to, like me, unclench your jaw, okay? My jaw gets clenched sometimes. Okay. And go ahead and close your eyes. Okay. Don't worry. We're all virtual, so nobody's going to be watching you with your eyes closed. Let's take a deep breath. Right. So breathing in through your nose. Count of 4. 3, 4. Slowly breathe out. Again, let's breathe in through the nose. 2, 3, 4. Hold. 2, 3, 4, out, 3, 4. So go ahead and continue this form of slow, relaxed breathing. And with each exhale, I want you to imagine each of those specific pieces of clutter exit your mind as your breath is exiting your lungs, right? Inhale and exhale that coffee spill. Inhale again and exhale the morning traffic. Inhale and exhale any concerns about your email inbox. Now, with this next inhale, I want you to focus on this current moment, allowing your mind to absorb all the information you're about to absorb. Now, as you take this last deep breath, you'll find your mind open to the learning that you're about to embark. Slowly exhale, and as you do, you can go ahead and open your eyes, come back into your room. Okay, good. Hopefully you're feeling a little bit more relaxed and focused now that we've done that. And I appreciate you walking with me through that. You know, I actually feel like it's important for us to get into the right mindset at the beginning of a training, especially one when we're virtual. And there's even further potential for distractions throughout our time here. So I appreciate that. And now that we are focused, let's dive right in, right? Some of you might know this fact, but since 1962, employee assistance programs have been dedicated to fostering connections. Amid the pandemic, EAPs really stepped up to deliver mental health support to employees and families globally, adapting to social distancing and remote work demands, right? Telehealth became the primary avenue for accessing services, providing assistance during the most challenging times that we've seen. As the world is embracing digitalization and the need for accessible mental health care, right? It's crucial that we are equipping clinicians with telehealth skills to nurture really meaningful connections. Now, EAPs remain committed to supporting employees and their families, ensuring that they receive prompt and effective care whenever, wherever needed, right? So today's presentation is designed to demonstrate effective ways to bridge the gap between clinicians and clients providing telehealth counseling, right? Today, I'm going to highlight the many benefits of telehealth therapy, explain how to optimize each session, and share how to really mitigate any of the difficulties that a clinician that can come up when a clinician and a client aren't physically in the same room during a session. Okay, so as an audience member, I'm really hopeful that you're going to be able to leave today's presentation feeling stronger and more confident in your own telehealth clinical skills. Okay. All right, so history overview briefly here. How did telehealth actually get its start? Well, in the early 1900s, right, there was this minister by the name of Harry Marsh Warren who used telecommunication in order to reach people who are in crisis, actually providing a hotline for suicide prevention. So probably the very beginning of our suicide hotlines these days, right? In the late 50s, early 60s, Telehealth, telepsychiatry began to gain footing as the University of Nebraska used video conferencing to offer psych services and consults. NASA began putting medical care teams together to monitor the health of our astronauts while they're in space, right? Also providing medical advice as needed virtually. Around the same time, telepsychiatry was being developed, again, way to go Nebraska, by the Nebraska Psychiatric Institute to provide therapy and training. And in 1989, which was after a devastating earthquake in Armenia, the US and Soviet Union at the time were able to collaborate in clinical conferences virtually, which was actually the first time telehealth was used in response to a natural disaster. Now, the exact evolution of teletherapy wasn't quite as clear for me. As a matter of fact, I actually wound up falling down a rabbit hole while I was researching for this presentation, found myself looking up when the first advice column was ever published, and it was the 1600s, go figure. So there's your trivia tidbit for those of you who do trivia nights. And then our online publication that we now know as Psych Central actually got its start as a public health chat. Now, many years ago, this was even before my EAP time, I was a therapist for an online service, Talkspace. Some of you may have heard of that. At that time, in my memory of the details of this are pretty sketchy, but at that time, I remember it was not really a chat-based organization, but it was more so the client would pay for the ability to send messages to the therapist. The therapist would log on at certain days of the week, certain times of day, and we would respond to those messages. And it was kind of a back and forth that way. I think some folks even had the ability to do video, although I was never asked to do that, right? But that was one evolution of online virtual therapy that I recall being a part of. Now it's my understanding that programs like Talkspace, BetterHelp, and similar act as full-on video conferencing systems, right, for actual video teletherapy. Well, so with the evolution of that technology that these programs are using for these apps, the improvement of the internet, the fact that insurance is covering most telehealth services, and with the implementation of HIPAA compliant software, folks are actually choosing these platforms much more than ever before. Right? The use of telehealth services has grown pretty much as quickly as the telecommunications industry has. Now, according to the APA.org 2023 practitioner survey, that since 2020, we've actually seen a decrease in fully remote practices, which was to be expected. However, rather than seeing an increase in fully in-person practices, it's more of this hybrid model that we're seeing on the rise as our new normal, right? So now most clinicians are offering a mixture of in-person and virtual services. And I imagine we're going to see that trend continue in the next few years. Benefits, right? Now, many resources out there are in agreement on the vast benefits of telehealth therapy, and they echo these here. So for one, we have increased accessibility, right? Now that telehealth is becoming more widespread, individuals who live in rural areas who wouldn't previously have had the opportunity to get mental health treatment of any kind are now able to access it, right? Whether a practice is private, a group agency, a community mental health agency, they are typically found in areas that are more densely populated. Clearly, because this is due to being able to access more people and provide services to more. Now, as long as our clients and patients are able to access reliable internet services, they are able to have these sessions even with providers who could potentially be hundreds of miles away, right? Eliminating these long drives is what has increased the likelihood that a patient is going to seek out care. Telehealth services are providing more immediate care to patients, allowing them to be seen virtually much sooner than in person, right? This is particularly helpful for patients who have transportation constraints, mobility issues, things like, medical or physical restrictions, things of that nature. It's convenient, right? So virtual appointments help to save both patient and provider time. With the availability of virtual teletherapy actually comes the increased options for when an appointment can be scheduled. So when appointments were really only offered in person, many people were only able to access care, say, after work hours or on the weekends. But now virtual therapy is allowing some folks to even schedule sessions during their lunch hours. I would honestly be seeing my chiropractor a lot more often if I was able to do those appointments virtually, right? We have flexibility with telehealth, right? So weather could be a major factor with teletherapy or gaining or accessing services. So when in-person appointments were our only option, sessions were often canceled, postponed whenever there were storms, inclement weather, things of that nature, right? This is ultimately delaying services. But now with the implementation of virtual therapy, we don't really even need to skip a beat when weather isn't cooperating with us. And you can take illness into consideration, right? So as long as our illness isn't severe enough to require, full-on bed rest, most sessions can still be completed through some, minor coughing, sneezing, things like that, right? And obviously, we greatly reduce the risk of even getting each other sick. And I'm sure a lot of you who are practicing clinicians would agree with me that, I would much rather hold my appointments through some minor cold or allergy attack rather than have to reschedule multiple clients, right? Inconveniencing them as well. Now, again, as long as we're not pushing ourselves and we, we're still able to take care of ourselves, of course. It's cost effective, right? We're seeing more and more insurances are covering the cost of a teletherapy appointment just as they would an in-person appointment. Now, we of course need to be careful and mindful about how we're submitting billing for those sessions, but with proper coding, virtual appointments are typically covered. Okay, now there's a few things to consider with this. One being, what are the requirements from state to state? The services must be provided through HIPAA compliant platforms, and I'm going to talk more about that later on in the presentation. They need to be designated as a telehealth visit when we're doing coding, right? So some insurance companies are going to ask for a differentiation between virtual and in person. Clients also need to be physically in their residing state at the time of the appointment. And I know that's a little bit different with services offered through EAP versus general practice. So there's a little bit of a difference with that. And then what is covered is actually determined by a specific insurance plan. So one client might have something different covered than another client. Okay. And then, of course, finally, all of these benefits accumulate into one major benefit to telehealth counseling, in that it takes away the stigma of receiving mental health treatment, increasing our overall privacy, right? So, as most of you know, even an EAP service provided by an employer is going to practice strict HIPAA guidelines, and that the employer is never going to be notified of their employees' participation in those programs, right?
Jay, can I ask a question
Yes,
about your
please.
previous bullet point regarding cost effectiveness? You
Yes.
mentioned that patients have to get it, um, they have to be in the state they reside in. What about licensure for the therapist? Do they have to be licensed in the state that they're delivering the service? Is that correct?
Yes. Yes. And, this is very recent. I mean, as far as I'm aware in my own practice, it was what I learned was very different from moving from the EAP world into the private practice realm. So there's a little bit of some differences there. Um, I'm licensed in Illinois. I'm able to practice obviously in Illinois, and I'm able to see any clients who reside in Illinois. But if my client were to be traveling out of state, we'd have to skip that appointment. Okay. However, when I was under EAP, and I'm sure some of you are aware of this too, I'm licensed in Illinois, but there were some differences with how EAP works as far as I was able to speak with anybody really across the globe. So I think that's the difference between EAP versus private practice. But yes, I need to be, or I should say this, the client at least needs to be located physically in the state that they reside and obtain their insurance through. Yeah.
Jay, one comment.
Yes.
EAP is not licensed. EAP may be certified, but the clinician license determines the state regulations and what happens with them. So it depends whether they're LCPC, LCSW, PhD, PsyD, whatever. That's the part that matters.
Gotcha. Okay, very good. No, I thank you for chiming in on that. Appreciate it. Very good. All right. Yeah, I knew there was a little bit of some nuance with that when it came to EAP versus private practice. And so we might see a little bit of that as well, moving forward. So yeah, those are the benefits as far as I'm concerned with telehealth. Now, Asher, if you want to, this is actually a good place for you to administer our first poll question.
I had a comment quickly.
Yes, please. While he's doing that, go ahead. Or while they're doing that,
really, I clearly know if you have a license, you have to practice only in your state with people who are in your state. But then I think, are we saying if someone is not licensed, but they're a certified SEAP, that SEAPs would be able to talk to clients outside of the state they're practicing in?
You're asking if a person who's certified, so CEAP, CEAP, is able to work with a client who's out of their state?
Correct.
Yes.
If they're
Yes.
not licensed as a clinician.
Right. So, and most SEAPs are licensed as well. But if
Right.
there are some that are certified and not licensed, that then that they really can talk to clients elsewhere. I guess I never really thought that part through.
I think California is the one exception to that. I don't think even a EAP person, non-licensed person, can do EAP work in California. And I think the difference is EAP people don't diagnose and technically treat versus licensed people do.
Right.
Right.
So that would be the issue, is that what services you're providing. Because if you're providing therapy, then you have to go according to your license. EAP services may not always entail therapy. So you could be giving resources and so forth, and not be licensed. You could do that anywhere. But I would also add that there are these reciprocity license, and I wonder how it affects, how these services. So you'd have to research your license and the reciprocity, and whether in the state where it's reciprocal, whether you can provide services there, how that would work.
Well, at one of our previous meetings, there was a lady that worked with the Illinois Department of Professional Regulation, and she
Hmm.
said, if you have a license, it doesn't matter what you call yourself, I'm a consultant or whatever, you have a license. So the license governs. If I remember correctly, that was the comment she made. So
Yes, your license governs, even if you don't tell anybody you're licensed, but you tell them you're a C, your license governs, and you can run into problems with that. There is also something called, for social work licensure compact that allows certain states allows social workers to practice in all compact states, but you'd have to do more research to find out what is what, and Illinois is not one of them, nor is Wisconsin.
Counselors and psychologists also have compacts that are adding states on an ongoing basis.
And all of that is very new. It's kind of in
Yes.
the works right now as more and more states are joining the compact and doing all of that. So that's even, very new for me. And it's interesting. So these are really great questions. Working 9, almost 10 years in an EAP, I just know this is what I was doing in the capacity as a telehealth counselor for an EAP. Moving from that realm into the realm of a private practice therapist within the state of Illinois with a state license, with an Illinois license, those are the things that those are I guess the boundaries with which I knew to practice in, right? So forgive me for being a little naive to some of the nuances of nationwide. I know California. I knew that about California being a bit, different with that. But yeah. So these are the different things that in everything that I say here today, and in everything that we discuss, the real best rule of thumb to go by is, what are your licensure laws in the state that you're practicing in and in the capacity that you're practicing within? That's really your best bet. I'm going to talk about phone counseling in a little bit as well. Again, same rule applies. Whatever your licensure laws are, that's what you want to adhere to. So, yeah.
You speak California, they have no reciprocity agreement.
Right.
If you want to do work in the state of California, you can transfer your license to California using an online form. Then you'll be licensed in California and nowhere else.
Righty, thank
Nowhere
you. Thank
else.
you all. Just to pull us back on track here a little bit though, we're gonna run this first poll. And as a reminder, for the remainder of the presentation, please, outside of designated Q&A portions, if you have questions or comments, place them in the chat for the presenter to address as she's able,
Yes.
and to help make sure that we don't get bogged down in extra conversation. So we're gonna run that first poll now for a moment. We'll give you about 60 to 90 seconds to answer that. As a reminder, we do need to get responses to all of these polls from you in order to provide CEUs. So please do make sure to submit that response. If for whatever reason, technical difficulty, whatever, it won't let you submit a response to the poll, please send me a direct message in the chat so that I can kind of log your response that way. As long as I have some kind of record, some note that you interacted and we're here right now while the poll is running, will be good. All right, I see lots of responses coming in. We'll have another maybe 30, 45 seconds.
And to reiterate what Asher just said, I do have a full, blocked off time at the end of the presentation that I'm happy to answer questions and really open to fielding any comments that you guys have as well. So there's a whole time frame at the end with that too. I should have mentioned that before I started. So.
Another 20 seconds, but I think we've got just about everybody here. Just a handful more that might still need to respond. All righty, we're going to close that poll here. Responses here, we'll share our results for this one. See, we had About 1/3 of us answering true and 2/3 of us answering false.
Guess that speaks to my question there. All right, am I ready to move forward?
Yes, absolutely. Thank you,
Okay.
Jay.
Perfect. Yeah, absolutely. There we go. Okay. Now, talking about the efficacy of telehealth, unfortunately, we all do think of one thing when we hear that date of March 2020, right? And that's the onset of the pandemic. Now, when it all began, I remember actually being very grateful for the internet and the technology that we've become so accustomed to. Now, of course, I was happy to not be among the millions of people who unfortunately were laid off during this time, but I was even happier at the fact that my services as a mental health professional were still available. Now, this was during the time, I'm sure, again, some of you out there are going to remember that, I was with the EAP. I was also seeing clients in a private practice capacity as well toward the later years there. So when the lockdown began, I was already fully equipped. I was able to continue at home with all of my work. And so there really wasn't a missed beat with any of the scheduled appointments. And as you know, there were appointments, right? If the teletherapy world was already growing quickly, the pandemic became its turbo boost, right? Now, thankfully, we are seeing more and more studies these days that are showing that online therapy is just as effective as in person. Cognitive behavioral therapy is the modality that seems to be right now the top contender when it comes to providing mental health virtually, right, or through telehealth. And according to a Forbes online contributor, quote, literature review of 14 studies found that online CBT has led to 50% improvement in symptoms of panic disorder, social anxiety disorder, generalized anxiety disorder, depression, OCD, compulsive gambling disorder, quite a good list, right? Online CBT was also found to significantly decrease the impact of stress and chronic pain, or I should say chronic fatigue. The length, here's the cool part, the length of online CBT sessions was between 8 and 15 weeks, which is considered a short period of time in therapy. Also sounds about similar to our EAP protocol, right? Now, there is still much to learn about the effectiveness of teletherapy, but I don't think that's going to be too difficult considering that now in this more post-pandemic world, it certainly looks like telemedicine across the board is here to stay. But unfortunately, this doesn't come without some drawbacks, as I'm sure is, really with any good thing, right? So let's take a look at what some of those are. First, our access to technology, okay? Technology is a big pro to telehealth and teletherapy all the way up until it doesn't work, right? Now, if you live in a densely populated area where cable and fiber optics and 5Gs and insert internet word here is good, well, then great, you're in luck most of the time, right? But if you are like one of those folks that we spoke about earlier who live in a more rural area, the internet connections and Wi-Fi signals might not be as powerful. This pretty much leaving you to the whim of the internet gods. Or maybe I should say the internet clouds, right? Did I use that internet word right? Hopefully that joke landed. But anyways, how about access to privacy? Now, since telehealth services began to gain popularity over the past 4 or so years, I have seen the inside of most of my clients' vehicles, most of the time from their driveways or their garages or even a parking lot somewhere. And this because finding a private place is much more difficult for some. Also, I've met more children and pets that I otherwise would never have met either. Now, as a clinician, I know that I need to extend additional patience and grace as we see the times basically change right before our eyes. Now being the days where we see more people at home, whether they're remote employees or even students who are e-learning. So we are more likely to be speaking to a client who might be interrupted by a little one who needs their attention. Or really, if I had a dime for every time a cat knocked down a device, I'd have a pretty good pile of dimes at this point, right? We're seeing slower rapport builds as a drawback, right? Now, later in this presentation, I am going to go over some effective ways of building rapport with clients over virtual formats. But the fact of the matter remains that, when we're doing telehealth therapy, that rapport building can be slower. Now, while it's not impossible, it can be still more difficult to demonstrate empathy and understanding through video, which causes that rapport build to move slower. Body language, right? Body language piggybacks off rapport. So another difficulty with building rapport is that we can misinterpret body language or even miss it altogether, right? This could leave your client wondering your reactions and even your judgments to something that they shared. Now, in fact, human communication relies quite heavily on how our brains interpret and judge another person's body language. Conversely, we as the therapist can miss important body language cues from our clients. For example, a shaking leg can provide a lot of context, but not if we're not seeing it below the camera. Okay. And then with telehealth, we do have it's limited to a less acute concerns. Unfortunately, telehealth virtual counseling isn't suitable for everyone. Okay. Folks who have higher acuity would do better in face-to-face settings. Now, this doesn't mean that we're completely turning, these folks away from virtual settings, but a virtual session really should only be used as a last resort situation, kind of only as needed. Because in these cases, we do see a higher risk of difficulty self-regulating, staying on task. We see increased distress, lack of focus. Okay, so because of that, we really should be seeing higher acuity patients in person in order to offer the most effective support. Okay. I'm going to go into a little bit of a game here, but before I do that, I know it's a bit soon, but Asher, you can go ahead and administer that second poll question here real quick.
Awesome. Thank you, Jay. We'll get that poll up here. Second poll. That should be up for everybody. We'll give that about 1.5 minutes, 2 minutes, so that everybody has time to run through this, get their responses in. Again, if you experience any technical difficulty with the poll itself, please drop me a direct message in the chat, just noting, that you're having the difficulty and that you are here.
I love seeing the answers come in.
Righty, we've got most of our participants here. So there's still a few outstanding responses. Give it a few more seconds here. Thank you all for so diligently popping those responses in right away. I think we got up to 25 in like 4 seconds after I hit launch.
Let me see if I can switch to my earbuds.
Righty. Should be pretty
Right.
much all of us.
Can everybody still hear me? I just switched to earbuds. Am I still audible?
Yes, we can still
Okay.
hear you, Jay.
Oh, good.
Right, we'll share those results as well. Cool.
Great.
Great.
All
Thanks, Jen.
right.
Back to
Yeah,
you.
thank you. Sounds good. Okay, so like I said, we're going to play a little bit of a game here, okay? And so if you have a pen and paper, you want to jot down your answers, yes or no. This is just for you. We're not going to be doing this interactively sharing, but I want to get a sense of who you think teletherapy is appropriate for, okay? So first, is teletherapy appropriate for someone who lives in a rural area? What would you say? Yes or no? Go ahead, jot down your answer. Again, it's just for you. Someone who lives in a rural area. What do you think? Well, survey says, yes, I would say that teletherapy is appropriate for somebody who lives in a rural area. Like we mentioned before, that is one of the benefits of teletherapy being so widespread. How about somebody who has limited internet access? Is teletherapy appropriate for this person? What are your thoughts? Yes or no? Indicate that on your own sheet. Well, I'm going to say no, right? Limited internet access means that our connection is going to be spotty. It might mean that it will work one day and doesn't work another day. Hey, therapist, I can't log on. I don't know, I can't connect, or we pause, break session. Those kind of interruptions aren't really therapeutically productive, right? How about a patient who has acute psychosis? Maybe this is somebody who is still, seeing, hearing auditory hallucinations, visual hallucinations. Would teletherapy be appropriate for that individual? What do we think? Yes or no? Well, survey says no, right? Again, we're wanting to provide the best support possible for any client across the board, whether we're EAP or private practice or somewhere in between. So for acute psychosis, this individual would be best supported in an in-person setting, okay? How about couples, right? Some of you may see couples, some of you may work with couples. Do you think that teletherapy is appropriate for couples? What do we think? Yes or no? Now, on this one, I indicate yes, okay? I work with a few couples. I have one, they sit on the couch together, they have their laptop, I can see them both, I can hear them both clearly, works really well for their duration of their session, not a problem. I have had couples in the past who were in different locations, they each log on using the link, they're able to participate, they're in private locations, and everything works out. So for the most part, I would say couples does work with teletherapy. How about a parent with young children? What do we think about this one? Okay, some of you might kind of go back and forth, yes, no, I don't know. Well, this one is yes, kind of, and that's why my check mark is a little bit off the box there, because it's a kind of, right? We're looking at individual, probably a case-by-case scenario here. Is your child, in another room, keeping themselves occupied, watching a TV show or doing whatever they're doing, and they're out of the way? Great. Is the child climbing all over you and hey mom, hey mom, hey mom, hey mom, hey mom? Then that may be a little bit of a different story, right? So that one's kind of, okay. How about a patient who is doing more of a hands-on kind of experiential treatment, EMDR or some sort of exposure, even some movement therapy? Would this person be appropriate for teletherapy? What do we think of that? You put your yeses or your nos. It's another thought-provoking one. I give this one even more of a maybe, right? So there's a couple things to consider. First of all is the skill of the clinician. So are you just out of your EMDR training, or have you been doing EMDR for a few years now, several years? So it's the skill of the clinician with the modality that they're using. I think that really makes a difference in whether teletherapy is appropriate or not. Even the client themselves, right? How participatory is this person? How motivated are they? How dedicated are they to their treatment? Are they really working hard even though they're virtual? That's something to consider as well. How about teens or children? Right, some of you may be seeing teens and children. These folks are those that are probably pretty professional at e-learning nowadays, so they're used to that kind of format. But would they be appropriate for teletherapy? Thoughts on that? This one I say yes, but I also say with clear guidelines. We want to make sure that there's always a parent or a guardian in the household at all times. During the session, throughout the full duration of the session, we want to make sure that that guardian is accessible if need be. And then also I would give a guideline that your devices, your cell phone, your video games, your tablets is all out of sight, out of mind, so that we can focus on the session. So a couple of guidelines to include with teens and children. And then what about a patient who has persistent suicidal ideation or even active domestic violence? And by active, I mean last incident within the past 1 month. Okay, is this person appropriate for teletherapy? What do we think about that one? Yes or no? Well, here I'm going to say no. Again, this speaks to the acuity of the situation, right? Wanting to make sure that these folks are getting the best care possible. So maybe we're doing only in person for them until, you know, things settle down, and then, you know, at some point we can transition to virtual. But those are my thoughts on that. Okay, so hopefully you had similar answers to mine on this. Okay. Wow, I guess I'm flying right through these poll questions. We're getting them out of the way quicker than normal, but go ahead, Asher, you can. Don't worry, I have more poll questions at the end, so you're not all off the hook that you're going to get to run away.
We've got plenty of them. I'm going to launch that here. And then while I'm launching that, Jay,
Yeah.
we've got a question in the chat from Carol Hoffman. If you want to pop out a comment in response to that. Here's our
Okay.
poll up for everybody
Here's
to
your
answer.
poll. You know, and I'm seeing things, but you know, I gotta be totally honest. I use different formats every time I present, and so I can't say I'm an expert in any of these formats. Asher, are you able to read the question for me?
Yeah, of course.
Because
Carol just
the way
asked,
my
is
screen
therapy
is-
by telephone considered teletherapy?
Yes.
Okay.
Yes.
And I think she might have popped that around when you were talking about like a patient with intermittent internet access. So that might be like a relevant concern there.
Yes, and I am going to go over that in a later portion of the presentation here. And this kind of brought up for me a similar question when I was doing research with this, because again, my experience as an EAP telehealth provider was different from my current experience as a virtual therapist. In that, what is allowed when it comes to using phones, and like I said, I'm going to get into that later on in the presentation. But my general answer is going to be, if you are in the capacity of working for a private practice or even on your own, make sure you default to your licensing and the insurance. You know, some insurances will say sure, other insurances will say no. So, but thank you, Carol. That's a great question. Like I said, we'll dive into that a little bit further too.
Awesome.
Yeah.
All our responses there for the poll. Share our results. A+ for the class.
Good job.
All righty.
Good job. Good job. Okay, so let me do that. All right. Right. So when it does come to providing virtual sessions, of course, we want to make sure that we are using the time allotted to the fullest benefit. Okay. So I do want to touch very briefly on what solution-focused counseling looks like, because as some of you or all of you might know, it is a major component of EAP counseling. Okay, so how do we use the time we have and optimize it the best way, right? So for example, if a client only has 6 sessions allotted to them, we want to ensure that we're getting everything, that they're getting everything that they need from the therapeutic process in that amount of time prior to being referred to long-term care, right? So solution focused therapy is going to be extremely action-oriented, goal-directed. And that does include even for presenting issue like depression or anxiety, okay? Right. A key component of solution-focused EAP counseling is being focused on the present, right? So in that first session, you really should determine what is going on for the client in the current moment. So all clients have a background, which often includes childhood traumas or even negative experiences, and they're going to want to unpack those. Right now, while it's fine to dabble in that background in order to get some further understanding of your client's, point of view on things, those deeper rooted topics should be addressed in long-term therapy. Now, I do hear the questions that are probably popping up in your heads right now that, what if a client brings up a childhood issue? Am I supposed to just ignore it? Absolutely not. Of course, I don't want you to ignore really anything. Make sure you do touch base on what they bring up for you. But if you know you're going to only be working with that client for a certain number of sessions, and then you'll be, referring them on, then maybe only briefly touch on that topic and how it relates to what is happening with them and what's going on for them now within their current context. Okay. But if you know you're going to be transitioning from their EAP benefit into their insurance benefits, their managed care for long-term, then by all means, there should be no reason why you shouldn't go ahead and start to unpack that whenever it does come up. Okay. And I guess that also, that's differentiated between a person using their EAP benefit versus using their insurance benefit. And I can go more into that at the end if anybody has questions. I just didn't include it here considering my audience. But anyways, as I stated before, short-term solution-focused counseling needs to be goal-directed. Okay, so you're going to want to work with your client to help them identify some short-term goals that they want to work on during their time with you. So start by identifying what's the most immediate source of their pressing issue, their presenting issue. What's the most immediate source of that? Okay, now we're going to go into the specific breakdown of each session here in just a few minutes. But help your client to name the changes they want to achieve. Even if it's, well, I want to not be so depressed. Okay, we've identified that. Okay, this is essentially going to help you to create the level of treatment plan that you need. Okay, again, whether you're doing a treatment plan for full practice or a treatment plan as it pertains to EAP, that's going to help you do that. Now, along with goal-directed, we also need to have action-oriented. So once your client has identified a goal that they want to achieve, next is going to be to determine what actions they want to take to move toward reaching that goal. Okay, so it should be short term. There is no expectation that in a short term protocol of EAP that their goal is going to be fully accomplished. So these goals should be short term rather than long term. Solution-focused therapy is going to include the implementation and practice of coping skills as well. So your clients are going to be spending their time in between their sessions, taking the discussed action steps, as well as practicing the necessary coping skills that will help them to address their presenting issue. Okay. Now, in order to best optimize the number of sessions you have, this is what your breakdown should essentially look like. Okay, so for sessions 1 and 2, this is where you're doing your assessment. You're getting that brief background of their presenting issue. You might need to get some additional background in session 2 if need be, which is totally fine. But by the end of session 2, you're going to be able to formulate a plan. You're going to be able to offer up hope to your client, letting them know that you're going to give them some good tools and strategies that they're going to find helpful in moving toward resolution, right? Within these first 2 sessions, you're basically gathering that, well, what brings you to therapy details, okay? Providing you again with your presentation and maybe even diagnosis in some cases. Now, in my experience, the dialogue around these first couple of sessions usually goes something to the effect of clients saying, well, you know, I'm here because I'm extremely stressed out. My job is not going too great. I'm getting some bad feedback from my boss. I'm also fighting a lot with my husband, things of that nature, right? So you as therapists might respond by, again, let's narrow them down. What is the most pressing issue right now of those that you just described? Well, probably my job, because my husband and I are arguing because me being miserable at work, or because of me being, you know, having these issues at work. Okay, so that's the most pressing. Great. We're going to offer validation, certainly, letting them know that, well, that must be pretty troublesome for you. I understand that. Okay. Again, offering them that hope, letting them know we're going to work on some really good strategies here. Okay. I oftentimes told my clients when I was working in that capacity, you know, realistically, we can't say that, you know, your job is going to be wonderful by the time you're out of these 6 sessions, but I can tell you that with the skills that we learn about here, you're going to be able to know how to apply those even beyond our time. So that was really helpful to a lot of them. Those middle sessions, in this case 3 to 5, this is where we're providing that solution-focused, action-oriented therapeutic process. Okay, that's where they're really practicing these things. Okay, so once we have obtained that, what brings you to therapy information, the next is what can be done about it. So that's the kind of general focus of those middle sessions. This is going to spark some really good brainstorming that will potentially lead to some good potential solutions for our clients to work on. Okay, giving them those specific action steps. Okay, so over those middle sessions. Now that final session, maybe session number 6 or whatever that final session is, this is where we're offering up our resources and referrals. Okay, so by this final EAP session, your client is going to have some really good understanding of what direction they're wanting to head into. Again, like I said, their problems aren't necessarily going to be solved at that moment, but they have a sense of hope, knowing where they're going. Okay. Now I'm just going to briefly mention this, and if we have further questions at the end, by all means, but there is kind of a side note here of a potential scenario that you might come up against if you are a clinician in a private practice that happens to accept EAP benefits. And that's, well, what if my client asks to continue with services beyond what the benefit allows? Okay. Now that one, I'm going to say, go with whatever the protocol is, but you as the clinician are going to use your best discretion to determine whether or not you're going to continue using EAP benefits. Every year, these benefits are going to renew for most benefit plans. They renew on the 1st of January. So they might be asking you, but with the point of EAP, the purpose of EAP is that we're offering short-term assessment and referral. Using their benefits over and over again basically negates that purpose. Okay, so this is where you might need to practice some level setting in transitioning that client into using their managed care long-term benefits. Okay, so yeah, I'm going to check in here. I think it's break time. I went a little bit further, well, not quite too far. About 10:51. Let's go ahead and take a break. If you guys want to go ahead and stretch your legs, do about a 10-minute break, which brings us, actually, let's do an 8-minute break, which brings us to 11 o'clock. If Asher, if I have your approval on that, is it okay to start up again at 11?
Yes, absolutely.
Okay, once we do that, if I start up at 11, that should put us at about 11:40 to start Q&A, and then that gives you guys, I'm gonna honor your time and make sure we exit everybody here at the proper time. So let's come back at 11 o'clock on the button, and we'll resume from there.
Awesome. Thank you so much, Jay. And while we're all on break here, I'm going to drop some links back in the chat again, just about our conference and networking event, those registrations as well, just in case anyone missed them earlier and would like to take this opportunity to register. We'll see you back at 11. Righty all, we are at 11 o'clock. We are back. Hope y'all had a good break. Take it away, Jay.
Wonderful. All right. Yeah, hopefully that was long enough break for you all to get your water or coffee. So get started again. Let's see, where did I leave off? Okay. Don't need to do all of that. All right, so another factor in optimizing telehealth is building rapport and trust with our clients, right? One great resource that I located online came from carepatron.com. I want to give them credit. Actually, this is a program that teaches clinicians how to build rapport and implement it into your practice and that. So I thought what they had to provide on their website was very insightful. So according to Care Patron, there are 5 reasons why you want to be sure to add rapport building into any therapeutic relationship. First, it promotes comfort, right? So when a client is already nervous about starting therapy, it helps to ease their nerves when you, the therapist, are showing a general intrigue in the client's hobbies and interests. So how do we do this? Well, you would do this by sharing maybe some of your own hobbies and interests where it's appropriate. I actually receive, you guys can chuckle at this, I receive major rapport points when I share my affinity for games and escape rooms with my clients. Go figure, right? I guess I have a clientele. So it also increases trust. So focusing on rapport helps to increase the trust, increase the comfort, because the rapport building translates into further trust that in the fact that you, the therapist, are going to continue to be interested in what the client has to say throughout the therapeutic relationship, which is extremely important. Rapport building activities do a great job of demonstrating to the client effective communication, and it models that they themselves do have the skills to communicate effectively with their therapist, right? Oftentimes people will put therapists on pedestals, assuming that we are the only ones in that relationship that are going to be good at communicating. But this helps to boost the client's confidence in their own communication skills as well, knowing that they're going to be able to have that reciprocal relationship. Building rapport encourages engagement, right? So taking the time to conduct a rapport building activity with a new client is going to increase engagement in the fact that they're going to be more invested in their own process, simply for seeing that you, the therapist, are invested as well. And then rapport building provides insight into who the therapist and the client are as people, which really helps for us to get to know each other much better. Okay. All right, so you see this very strange screen. We're going to do a little bit of a different type of poll here. So I want you to go ahead. This is time you get to take out your smartphone, take out your tablets or whatever you have device nearby you. Or if you have a second screen, I have a second screen. If you have a second screen, maybe open up a new tab and you're going to go to this website, slido.com. Okay, slido.com. And right there on the front of the page, it's going to ask you immediately for a number code. Go ahead and type in that code. Okay, that 1407319. It looks like there's a space on the screen, but there isn't. Don't put a space in. So if I can get, like, I know I only have a couple of your faces on my little minimized screen. Oh, I already got some answers. What are some of your favorite hobbies? Shopping. Great. Knitting, reading. I'm going to add my own here. Great. Reading. Yep, I'm going to add to that one. Reading, walking, Very cool. Cooking. Ooh, we like some cooking, lifting weights. Okay. Look at this. Wow, look at you guys go, all participatory. I'm seeing a bunch of words popping up on the screen. Hopefully you're seeing, you know, the bigger ones are the ones that we share, that we have in common. So running and reading are the most common, working out, hiking, shopping. Great. Oh, this is good. So I see a lot of exercise, a lot of outdoor activities. Very cool. Very cool. You see what's happening here, right? Hopefully you're all kind of seeing what's happening here with this little exercise. Reading still is the biggest contender here, the winner. That's fun. You can answer more, do more than one answer if you have a couple of hobbies that you enjoy doing. I gotta iterate that one. Right, very cool. Good. Netflix, oh, I see Netflix, that's good. Okay, take a look, right? You see that we have a lot in common with each other in our group here. Eating, that's one of my, food is my love language. So when I see eating, that's a good one. Very cool. Okay, well, that was hopefully a fun little breakup activity as you guys come off the break, off of our time there. So, right. So I want to give you a few examples of some good rapport building activities. Thank you guys for playing that game with me. I thought that was such a fun way of adding a virtual component of interaction. So, right. So I want to give you some examples of some good rapport building activities that you might want to try with some of your clients. And these that I give you, they'll work whether you're in person or virtual, but the emphasis on virtual, right? We just did one with that interactive word popcorn. I don't know that you would necessarily use that exact format if you're only one-on-one with someone, but it speaks to our first example here, which is asking a few conversational questions. I asked you what your hobbies were. That was a good conversational question. Reading was the top answer on that board. Obviously, we all have that in common. So I might ask you, well, what are you reading? What type of books do you like? What are you reading right now, right? So these conversational questions are obviously different from our assessment questions that we would be asking in our first session, but these are more get to know you questions, right? What are your hobbies? You might ask, what are your favorite TV shows? What are you watching these days? Well, you like to read? What book are you reading? You might ask, are you a cat person or a dog person? Do you have any pets? Or if you see a pet behind them or somewhere on the screen, oh, I see you have a cat. What's their name, right? Oh, I have a cat too, right? We're starting a little bit of a conversation, okay? We're not having a full-blown conversation for the full duration of our session. We want to be mindful of the time, but this is a good way of breaking the ice, okay? Over the course of, I don't know, maybe a few weeks, a month or so, you're going to be getting to know your client quite well. Now, part of the conversational questions activity is also being willing to give insight on yourself. This is what we're doing. We're kind of gaining some commonality here. So if you're not willing to admit that your favorite TV show is The Bachelor, then don't ask about favorite TV shows, okay? Or maybe give, your second favorite answer if you don't want to admit that, okay? Another idea is giving a virtual tour of your office, right, of your space. Now we're going to talk about the physical space of your virtual sessions here in a little bit, but if it's tidy and professional as it should be, right, go ahead, give your client a virtual tour of the space that you're in, right? They might think that your Lego Vespa in the background is pretty cool, okay, right? You can start each session or a few of your sessions here and there with a centering meditation or a few deep breaths, right? That meditation, very similarly to what we did this morning when we started. That was only a couple of minutes, so it didn't take up a whole lot of time, okay? So that might be a good idea. Or you can ask for a highlight and low light of their last few days or the past week or so. Modeling this by saying something to the effect of, well, my highlight was catching the latest Marvel movie in theaters, but my low light was ripping my favorite shirt Okay. Now, mind you, as a therapist, I'm only modeling the structure. Notice I only talked about ripping a shirt, nothing major. I'm not talking about, oh, my low light was getting into a fight with my partner. It's not my therapy session, it's theirs. So we want to be mindful of how we, the therapist, are participating in these rapport building activities, okay? So rapport becoming a key player in optimizing our sessions. Okay. So now you guys got to bear with me. We're about to embark on what's probably going to be the driest part of my presentation. So forgive me. It has to be discussed though. We can't go through this presentation without talking about confidentiality and privacy, okay? So bear with me as we get through this, but really quick, Asher, right now I have in my notes, it's time for you to administer our 5th poll question. So making sure everybody has gotten back to their seats after that break by this point, you can go ahead and hop on with the poll.
You said that's specifically the time for the 5th one?
Yes, unless I'm counting wrong.
Oh,
I might be counting wrong. The next one.
oh dear. One moment, please.
Yes.
While we work through a couple technical difficulties for your patience.
Or I could have missed one as well, but
This
whichever
one?
number it is.
Oh, no.
Yes.
No. Oh, okay.
Yes, that one. And you know what? There probably is another one right after that that would catch us up. So
Oh, yes.
we can.
All right, let's get some responses here for about a minute.
I think I gave you a total of 6 questions. So I know that if we even.
No worries. We can run this one now.
Mhm.
And then run the next one whenever your next one's scheduled, and then save one just in case that we can
At
run
the very end. Yeah, sure. That works. That
Perfect.
works for me. Okay.
All right, there's just about all of us responded there. We'll give it 10 more seconds. Just the last couple.
Yeah.
I need to
This is so neat. I've never had a intermittent poll question going on during presentation when I've done these. So this is really I think it's kind of cool. That's neat.
Ready, there we go. And that one, we'll share our results there just for a moment. Everybody can see how that poll went.
Good. All right.
Good to go.
Good to go. Perfect. All right. So here we go. HIPAA. What makes a platform HIPAA compliant? Okay. I would have to say that this piece of my presentation is probably more geared toward folks who are in private practice capacity, although across the board we have to remain HIPAA compliant regardless, right? So with telehealth services, we're not exempt from maintaining that privacy and confidentiality, right? So when you go into any healthcare provider's physical office, you're going to see and know that all of the medical records, patient information, and all of that is securely locked away, typically in their computer systems, right? And now I'm going to age myself a little bit and mention how I remember going into doctors' offices and seeing behind the receptionist rows upon rows, shelves of folders, right? Those are the medical records out there on the shelves. They had like little, gosh, help me remember, color-coded squares. I don't know what the codes were for, but they all have those color-coded squares. That's how old I am, so I remember that. Right? But even with our virtual healthcare settings, we need to still remain confidential and everything locked up, right? Now, there are a lot of choices when it comes to the software we use for our electronic health records or the EHRs, okay? Whichever is chosen by your organization. Obviously, it has to be HIPAA compliant. And a platform is HIPAA compliant if it adheres to these 4 requirements, okay? So secure data, okay? So the software platform used for any kind of telemedicine must have encryption, firewalls, and other safeguards in place to keep all user data across the board secure, okay? It has user authentication, okay? So it's protected and kept secure at all times. And to ensure this, healthcare professionals, even ourselves, should be using an EHR that requires user authentication, which basically means that anytime you log in, you're not only asked to enter your password, but you're also asked to enter usually a secondary login code that they tend to text to you or email you, or I don't know, click on all the boxes that have stoplights in them and stuff like that, right? So user authentication. Records activity. So the best HIPAA compliant software is going to also limit the number of people who have access to any given record, okay? So this might include only allowing yourself as the provider, the patient or client that you're working with, and maybe a dependent of that patient. So somebody named by the client, you know, that they allow to access their record, okay? Limiting access is also going to include maintaining the best practices, such as, you know, logging out of the software anytime it's not being used. And even for some, they're keeping track of how many people, who is going into a particular record and when, okay? And then finally, agreements that are being put in place between you, the provider who's using this system, the EHR, as well as the EHR software entity themselves. These agreements are put in place for protecting personal health information, okay? All right, I think we got through the driest portion of the presentation here, right? Now, in an effort to enhance teletherapy experience, we want to also consider the physical environment, okay, of the space that you, the clinician, are in, okay? So we need to be aware of how we are presenting and coming off to our clients. And you know, these are the folks that are choosing us to work with as their therapist over any other therapist, right? So we want to make sure that we're mindful of this. As it was mentioned before, you know, some of us are doing sessions via phone as well as via video, right? Some of you might be conducting sessions only via video, but either way, how you present yourself to your client is extremely important. It's these little things that contribute a great deal to building that rapport, okay, especially in a short period of time. So with phone sessions, you always want to be cognizant of how you might be sounding to your client. Tone of voice is everything, right? Using a soft, clear voice is going to help to elicit calm in the person that you're speaking with. Even though they can't see you, smile while you're speaking with them on the phone. Smiling on your end is automatically going to come across on their end as kindness. So when you're smiling as you're speaking, they're going to pick up on that, even though they can't see you, right? Now, of course, these tips are going to be equally important when it comes to doing video sessions as well. Okay, so with video sessions, it's important to give attention to what your client is seeing on their screen. Okay, professional appearance and dress is necessary, whether you're virtual from your home office, today I am, or virtual from your on-site office, okay? So make sure that you're always wearing clothing that you would wear if you were actually in person with the client, okay? got a button down shirt. I am wearing pants. I got jeans on for my casual Friday, right? So we're not wearing pajamas, things like that. We want to kind of set the tone in ourselves as well. Okay. You want to consider where and how you are sitting, right? So even though you might be at your own home, it's probably not a good idea to be, lounged on your couch, maybe wrapped in a blanket while you're conducting a therapy session, right? Sitting upright at a desk, being mindful of your posture is actually going to give a much better sense that your client is working with a professional in their field. It makes a difference. Okay. I talked about body language a bit ago, right? Body language making a big difference in how they are perceiving us. Okay. Environment, right? I always give the suggestion, and I even did it today before our presentation, to test your video equipment so that you have a good sense of what the client is going to see behind you. Okay. I suggest keeping your background clean, minimal, with only, 1 or 2 pieces of furniture. I got my 1 bookshelf on there, maybe 1 or 2 framed pieces of art. I got my feathers framed up here, right? Just minimal, clean. Okay. You don't want your background to be too distracting or even off-putting, right? And what do I mean by off-putting? Well, is there a pile of laundry that's visible behind you? Or maybe are there a pile of dishes on a table that might be behind you? Okay, that would be off-putting in my opinion. You might want to avoid being in an area where your background is too personal, right? I don't know about you. Personally, my preference would be that I don't have my bed behind me. I don't know, something about, my clientele seeing where I sleep. That's my personal preference, right? So while some of this stuff I'm talking about isn't necessarily messy or inappropriate, laundry would be, you do want to make sure that your space is going to look as professional. Your home office space is going to look as professional as your in-person office would, right? And then of course, privacy, privacy, privacy. I can't stress this enough. So just like you would be when you're working from an office on site, right? You would have a private office. The door would be closed. You probably have a sound machine going on. I don't have mine going because I'm by myself here, but you would probably have that going. Nobody can hear your conversation. Same thing for your home office. When you work from a home office, you might need to take some extra precautions, maybe locking your door or even making arrangements with family members that, hey, during this time, I'm the only one home, or during this time, my office space is completely off limits. Don't come knocking, barging in, things of that nature, right? Reminded of that newscaster whose little daughter came running in. But anyways, we don't want any of that happening, so we're going to want to make arrangements as necessary, okay? All right. Technology, this is probably the hardest part for me, just with my know-how, but for those of you who have them, this is helpful for your company's IT department to chime in here. So for those of you who have IT departments within your organization, they would be the ones who can provide information with regard to what type of internet and bandwidth and equipment, et cetera, is needed to improve your success at maintaining an internet connection, especially while you're working from home. Okay, they may or may not, they may provide equipment. I don't think that they would provide modems and routers, but they might provide VPNs or specific laptops that can manage the kind of connections you're needing, okay? So if you are practicing in the capacity of, you're the employee for an EAP or a private or a group practice, et cetera, in the very least, clear instruction on what equipment to get, how to use it should be provided. Okay, so for every organization I ever worked for that allowed me to work remotely from home, I was always told, you need these things, okay? For those of you who are, doing your own private practice, maybe you're independently practicing. A couple of things I thought of that you probably want to take into consideration, okay? Now, mind you, I am not an IT professional, nor have I ever run my own business, but this was just a few of the ideas that I came up with. So first of all, do you have the proper equipment? Is your modem router up to date, able to provide the necessary speeds? Is your internet reliable and big enough to do what you need it to do? Okay. Not only your work equipment is on these Wi-Fi's, but also any of your extraneous devices, your smart TV that's in the living room, your cell phones, tablets, etc., that are just like laying around throughout the house. All of those, if the Wi-Fi is on within that device, it's using that bandwidth. Okay, so we might want to consider the size of your internet plan. Okay, what EHR are you choosing? Is it suitable to meet your business needs? Okay, again, if you're independently practicing, does it allow for you to submit billing through the actual system itself? Or maybe you're choosing one that is kind of a one-stop shop, allows for video conferencing to be all in that one system. Okay, here's a big one. Is your email encrypted? Okay, again, I've always worked for organizations, so it's always been that way for me. And I personally don't know how to make that happen. But if I were independently practicing, I would make sure to find out how to encrypt my email that I use with clients. Okay, and I have a note here, Asher, for you to provide the next question.
Brilliant. We will pop it
Yeah.
up here.
Watching my time too. I think we're doing okay.
Right, that poll should be up for you. Asking that true or false question. And as a reminder, again, if you do have any difficulty responding to the poll for whatever reason, just pop me a direct message in the chat so that I can manually log your response.
Right.
Alrighty. Most of our responses there already. We'll give it
That was very quick.
another 10 to 20 seconds here just to make sure that we've got everyone who intends to respond.
I see why I'm not getting, so the bar that has the chat is up on my other screen here. Okay, so that is, don't worry, everybody. We'll make sure that everybody's questions are answered. So, okay.
Alrighty,
good?
close that poll here. We've got all our responses. We'll share our results.
Okay.
Work. You're good to keep rolling, Jay.
Wonderful. Okay. All right. Got through the technology piece. Okay. Well, what about the difficulties that can possibly come up while we're conducting virtual services? Okay. Some of you are going to get a good sense of where I come from as I describe through some of this stuff. So I'm smirking for some of you here. But anyways, how do we address these, right? As we discussed earlier, we know that the internet connection issues are one of the potential drawbacks of virtual counseling, right? So we would be remiss if we didn't talk about what should be done in the case that we run up against any system issues, okay? So first, I always want to say, know what your company protocol is as it pertains to any system failures, okay? So we're talking a lot about the EHR that we're using, and like I said, there's a ton of them. But your company organization will likely have a representative that they're in contact with who basically works with the EHR software company, right? So this representative would be a great resource to provide, some potential backup solutions if the system were to go down. Certainly your manager will guide you on what options you have for handling this kind of scenario, right? Per their practice policies. When I worked at the EAP, we were doing pen and paper notes if the system ever went down. And then once it came back up, we would diligently enter those notes properly as soon as possible. So whatever the protocol is with that, right? There was that question about, can sessions be conducted over the phone versus not? Again, like I said, in the EAP capacity, there might be no concerns or rules against that. I used phone all the time when I was working with my clients. Now in a private practice setting, I wonder if it depends on the practice. I know that it depends also on insurance coverage. That's one difference between, doing it via insurance versus via EAP benefits, things of that nature. Okay. So again, rule of thumb, make sure you're following your company's policies and protocols, insurance policies, and things like that. Okay. You could also consider using what's called a third-party calling app, right? Some examples are, we use 8x8. There might be Ring Central. I don't know if Vonage still exists, but some of you might know of some of these that your organizations use. These are third party. They protect your phone number, so you're not calling from your personal cell, contacting a client from your personal cell. And they are, most of them, HIPAA compliant. They also, however, rely on the internet. Okay, so you can only use those services if you have your internet up and running, right? But speaking of internet, well, what if your internet does get lost, your connection? With that situation, if you lose internet altogether, there really isn't much you can do. Your system's not going to work. Typically won't be able to hold a session unless you are able to do it strictly from the phone. But you couldn't use the 8x8, right? So in this situation, really what your only choice might be is pick up your phone, using your phone data, send an email to your clients, letting them know what's going on and having them reschedule with you. That's actually the exact reason why I keep my client schedule in my cell phone. So I know that I have access to it, even if I can't get into my work system. Okay. To safeguard against any loss of connection, a couple of best practices that you want to maybe adhere to. Close any browser tabs you have open, any extraneous programs that you have open. All of those are taking up that bandwidth. So if it's not necessary for your session, close it out. Okay. You want to make sure you're also considering strengthening your internet, right? Again, so this pertains mostly to folks who are using their home office. Strengthen the internet plan that you have at home. Okay. Might also behoove you to invest in a higher quality equipment like modems and routers that I mentioned before. And like I said, I don't pretend to know really anything about Wi-Fi's and modems, but I can tell you from my own personal experience, I wasn't even able to stream my favorite TV shows on my TV, the Fire Stick, because my modem was so old, it wasn't even running the bandwidth that I had access to, right? So as soon as I got a new modem, fixed that problem right away, knock on wood, okay? Or if you have an Ethernet cable, something like that, that you can plug right into your computer from your modem, that does do a little bit to boost the strength, I believe, okay? Another way of addressing potential problems that come up with teletherapy is to make sure that you're prepared to overcome any distractions, okay, that might occur. Remember that mindfulness activity we did at the very beginning of our time here together? That was really for the purpose of setting the tone for our time here. If you were to opt to do something similar to that with your client at the beginning of a session, it really does help to set the tone, letting them know, hey, right now is the time for therapy. It's not the time for distractions. Okay, so it really does kind of send that message to our clients, sets the tone. Okay. Also, during your initial session, just as you would go over your new client paperwork where it talks about the protocols and the guidelines that you have for therapy, this is a really good way, and it's actually really important to go over the teletherapy guidelines as well. They should also be signing paperwork for that, letting them know, hey, client, during our session, we're not texting on our phones, we're not, doing anything off to the side. Tablets, TVs, all that should be turned off and out of the way so that we're not distracted. So that's a good time to go over that. How do you guys feel about children, pets? Like I mentioned before, we're going to be seeing a lot more of kids and pets and things during our sessions while the client is having their session at home, okay? So we want to set guidelines around this as well. I let my clients know that their kids are important, absolutely. So they can go ahead, address your child, answer their question real quick, open their juice box if they need it, right? But I'm not going to hesitate to ask that we reschedule if it's a continuous interruption throughout session, okay? Same thing goes for pets. I enjoy seeing the pets in the background. I like to see, they jump up and give a pet, whatever, that's fine. But and this is a true story, I have had a session with clients before who, she's spending more time petting her cat and talking to her cat and addressing the cat and showing me the cat on screen, oh, look at them, than we were actually having an actual session, right? This isn't therapeutically productive and it really does need to be addressed. So we want to make sure we're refocusing our client back to the session. Okay. All right. Crisis. There might be crises going on at a distance. So we are just as prone to seeing this happen in telehealth as we would be in person. Okay, so I want to make sure that you're prepared to know what to do if this were to go on. Okay. First, make sure that you're remaining calm. Okay. I'm gonna mimic a mentor of mine that I've had previously. You're the expert in this situation. Those words never left me. You're the expert in this situation. Okay. So use your strong clinical skills to de-escalate your client if need be, de-escalate the situation. Okay. I'm going to refer everybody to your own company's practices and policies and protocols for when it comes to managing crisis situation. Some may have you work with a colleague to get dispatch if that's part of your protocol. Some might have you call later on if need be. So whatever your company's, your organization's protocols are for handling a crisis situation, if somebody is voicing, endorsing suicidal ideation or things like that, default to what your managers and your organization would instruct you to do. Okay. So whatever that might look like, that's how I want you guys to proceed with that. Okay. See if I'm missing anything on this. Okay. The main thing is for you to remember that you are in control. The systems that you have, like I said, some have internal communication systems that you can dialogue with a colleague if you need some support. Some clients might have somebody with them that you can access for support, and if need be, do a safety check per your company's protocols. De-escalation is going to be one of your best skills at this point. Okay. Making sure that you're de-escalating as well as you can, even before it gets to that crisis level. Okay. So knowing that you're going to notice, you're a good therapist, you will notice the signs of heightened emotion. So this is where you put on a softer voice, you slow down your speech. If tears turn into sobs, reassure your client, go ahead, take your time, pause if you need to pause. Okay. You might instruct your client to mimic your breathing. Okay, Ruth, breathe with me. And you're going to take those deep breaths. Even in silence, right? You take those deep breaths. Okay, you might ask them to do a grounding technique. Hey, Ruth, can you do me a favor? Relax your shoulders, relax your neck a little bit. Hey, can you look around your room and name 5 things that you can see? Okay, can you maybe name 4 things that you are able to touch in your room? How about 3 things you can hear, right? And so forth. You guys are probably familiar with that specific grounding strategy. Okay, walk your client through that. Okay. Or if you have a client that you know tends to get agitated or deregulated or even, lacks focus sometimes, ask them to come to session prepared with a few fidget toys or maybe some calm strips that they can keep to keep themselves centered throughout the full duration of the session. Okay. So don't forget, you are the expert. You have what it takes to de-escalate these situations and to mitigate those. Trust in your own capabilities. Okay. All right, we did it. That was quite a lot. Okay. There's a lot that goes into providing successful telehealth services. We were able to touch on these most important aspects, preparing you to help build your confidence while you're delivering this modality of care. Okay, so you should have a better understanding of the clientele that telehealth services are best for, how to optimize the number of sessions that you are that are available to you, effectively mitigate any of the potential problems that you might come up against. So hopefully you're now feeling proud that you're part of a system that allows for people to access mental health care when and where they need it most. All right. So I see that there are some questions and comments in the chat. I'm going to open it up. If Asher, if you want to, you can ask that last poll question if it's necessary. Otherwise, the floor is yours.
Let's hold that last poll until basically like the actual end of the session, just for
Okay, sure.
But then for now we can open up for Q&A. And if
Great.
you want to stop sharing, I can unpin you so that everybody gets their gallery view back to see everybody's bright shining faces.
How's that? Did that work? Okay. Good. Great. All right. Any questions? I don't know if they're in the chat here. If you want to, and just so that I don't miss it, because I know there's a lot of conversation. If you want to unmute and just ask your question outright, that would be great too. Or if you have any comments, I would love to hear that as well.
Thank you, Jay. I just think that I've been doing solution focus so long, I forget all the steps to it. And then just to see that again, I was like, that's it. But you just aren't automatic to do those things. But I like the rapport building online. I never really, I thought that it's important what's behind me and what they see, but I never really thought about playing those kind of games and getting them involved in the session that way. So I will definitely do that. Kids don't bother me unless they're having a hard time being busy. If they keep coming in, then I kind of want her to make a decision about us rescheduling. Pets definitely don't bother me. Cats, dogs, walking, that kind of thing. Yeah, because again, I'm in their home. I'm physically in their home. And I think basically it's important to remember that I had a couple of clients who would want to have a session laying down. Well, no, you got to sit up. You got to sit up. I'm sitting up. You got to sit up. Or I don't mind if clients eat. It doesn't bother me because they may be on their break from work, or some of my clients are working remotely. I've been in garages. I've been in cars. I've been in bathrooms. I've been wherever they have a minute, wherever they have the time. But I had a couple of clients that she would be out, like at Jewel, or she would be at the laundromat. And I was like, wait, no, this is not good. Because you can't focus and, fold your laundry. So let's just reschedule. She was like, no, this is the only time I have. We got to get another time because you're not present. Are you in the laundromat? So it was just really helping her understand it's remote, but it still is just as serious as if you were sitting in my office.
Yeah, I'm actually glad that you brought up the part about laying down, because I have had that scenario before and I didn't even think about it to put it as part of my presentation. But we want to be able to have conversations with our clients to say, this is your therapy session. Yes, I'm in your home, but this is your therapy session. You know, I'm setting the tone for you. Like, there's got to be some sort of reciprocity with that, where we're like, okay, you sit up too then. Yeah, I like that. I'm glad that you brought that up.
Unfortunately, the couple, it was a marriage, it was a couple, and the wife was in the living room and the husband was laying down.
Mm.
I don't know what he thought this was, but I was like, not today, sir.
Yeah, yeah. Oh, I think he's running fall out. Very good. Thank you, Cheryl.
So
Any
along
other
with-
questions? Yeah.
Along with that was challenging. I had someone I was seeing who had a special needs child. She would not have been able to come in person anyways. And the child was such that she was all over her mother. I mean, there was no way that they could hardly separate. So it was really, I did the best I could with that person. I mean, but you can't really do much therapy. So it had to be much more around solution focused. You know, what resources can you use and what can you do? Because she was really challenged, this particular person, because she was a single mom.
Right.
So nobody to help her. So, you know, those situations come up. And then I had another person, now, of course, my brain, it just went out of my brain. Never mind.
That's okay.
With the pets, sometimes, you know, the dogs are barking so much that they have to put the dogs in a separate room. So we have to wait for that to happen, you know, and you would hope that they would put them in, you know, ahead of time, because they know the dogs are going to keep barking, that kind of thing. So, you know, it's challenging to do it, but you know, you can eventually get it done, I think. So,
yeah. I think in a lot of those cases, it's important for us to feel empowered as the professional clinician to say, okay, here's the guidelines, you know, let's, you know, I can see the flash of the TV going like this. It's distracting me. Maybe we can turn that off and focus in here. Or I love your relationship with your cats. They seem to be emotional support animals for you. That's great. But let's, you know, allow them to be pets and off, you know, is that great? I saw the cat, thank you, you know, and it's kind of a thing. But being empowered to kind of set those guidelines. And, you know, we're also teaching clients, especially those who aren't familiar with therapeutic process, how to do it. No.
Comment I have, I think one of the most interesting sessions I have regularly, one of my clients sits in her barn. That's where she can find private space. So we have the goats buying and all different kinds of animals and things, but that's where she can find privacy. So that's where we meet. The other thing I wanted to say is that many people don't respect the fact that they need to be stationary. I've had many clients who are driving, and I'll say, you know, Emma, where are you at today? And she's like, well, I'm just driving home from work. And I'm like, oh, you know, we're going to have to reschedule because I want you to be able to focus. And some of them get frustrated because it's like, this is the only time I could fit it in, is on my way home from work. And she's seeing me for stress. And obviously, then when she says, I have a school meeting tonight, I just get done with work, I have a school meeting tonight and this and this and that, I can't get it in. Well, it kind of points to her stress and can't have time. You don't have time to make an appointment or take time for you.
Right.
But anyway, driving is where I see a lot of people don't set boundaries. They assure me, I'm on Wi-Fi, I'll be fine. Or I'm on my handheld device, I'll be fine. It's like, no.
Right. Yeah. Good point on that one. I see here, chat, you asked, could you speak more about secure internet connections? Do you want to expound a bit on that question? Or if you feel like your question was answered?
My understanding was that you can't use just a straight ahead Wi-Fi connection because that could be it's not secure, so people could spy on a session. You know, or you can't use Zoom, right? Because again, people can spy on Zoom. So do you have any suggestions about other platforms to use, things like that?
Yes. Now, of course, at the moment, all of those platforms are going to completely escape my brain, but I can tell you this. Zoom actually, if you you can get the regular Zoom for however much, maybe it's free, however much money, that is not HIPAA compliant. However, there is a specific plan within Zoom that you can purchase that is HIPAA compliant. Okay, so I have worked with private practices before. We used Zoom, but we used the organization's Zoom, not Jay's, right? So there are certain versions that are HIPAA compliant. Somebody put in the chat Cisco. There's a lot of EHR programs that are, I don't even know if I even said this. Simple Practice is a name of another program that we use for providing virtual therapy. It provides your ability to do billing within that system, non-spawn, by the way. It provides your actual video conferencing. All of that is HIPAA compliant. Obviously, the one we used at the EAP, and I'm completely blanking. If you know which one that is, type it in the chat. I'm forgetting the name of it.
Somebody typed in Doximity.
Doximity. Okay, great. Yeah. So any of these, and I'm sure a quick Google search, yeah, secure video. Thank you, Amanda. Thank you. Amanda and I go way back, but these are all programs that they are using Wi-Fi. But they are HIPAA compliant, you know, the VPNs and all of that stuff. That's the whole point of choosing the right one, is so that you know you're not going to be spied on. So that was a good question to bring up for that. So thank you. Yeah. Therapy Works. Yes, thank you. Therapy Works is another one. Yeah, there's tons, right? So great. We have a couple of minutes just before I let Asher take the reins here. I'm curious about feedback, thoughts, comments on our little quiz, yes or no, who is teletherapy appropriate for? I did my best clinical judgment on answering those. So if anybody has any like, absolutely not, or whatever, I'd love to hear it if you have any feedback on any of those.
Hi, Jay. Oh,
Hi, Amanda. Go
Hi.
ahead.
oh, sorry, Cheryl. Sorry. I just, well, first of all, I really enjoyed the presentation. Thank you so much. And
Thank you.
I like in when you were saying is telehealth appropriate, yes or no, how some of them were sort of in between, because I really do think a lot of cases you have to take it on an individual basis and assess whether
Yeah.
it would be appropriate or not.
Right.
So, you know, it might be appropriate for one person with depression or passive suicidal thoughts, but it might not be appropriate for someone else with
Right.
similar symptoms, but for different reasons. Yeah.
Yeah, I agree. Like Cheryl's example, you know, maybe couples therapy is fine for telehealth, but if the, you know, one partner is over here laying in bed and it's like, well, maybe we should have you guys come in.
Right.
Kind of a thing. But yeah, thanks. No, that's good. Okay.
All people under the age of 10 have to come in. They just have to come.
Oh, okay. That's your,
Yeah.
yeah. Okay.
Because it's distracting. I'm distracted. Yeah, so we gotta see each other.
Yeah, yeah, I can see that. I can see that. Yeah. No, that's a good idea. All right.
This is Gail Monto. I'm with
Gail.
GIA Chicago. I know I am not showing my face because I am in a parking lot in a car.
That's okay.
I just wanted to say thank you so much for
Yeah.
an incredible presentation. Someone who did like exclusive, so much telehealth during the pandemic and is really a people person and needs to see people in person. I am just still a proponent of in-person, face-to-face. I think clients get so much more out of it. And as a clinician who is, like I said, a people person, that individual like contact, really looking at people in the eyes, assessing body language, I believe is preferable. And I loved your presentation. I think, you know, the pandemic made it so that telehealth is so much more okay with, you know, providing services. And
Right.
I'm still sitting here saying I'd much rather see you in person.
Fair
And I want
enough,
to meet
right?
you,
Yeah.
Jay, in person.
By all means,
So
let's, yeah,
anyway,
we'll do
thank
lunch.
you.
You're very welcome.
Yes,
No, I
thank
appreciate it.
you. Thank you again.
Good. Good. All right. I don't know, Asher, if you're, or if anybody, I mean,
Yes, if
there
we're,
you are.
oh, we have one quick
Oh.
last question
Sure.
from Michael Goldman that just came in a direct message. He
Oh,
asks,
okay.
did you say that research shows that outcome efficacy is the same between face-to-face and telehealth?
Yes, actually. The same, yes. I don't know if it's like much better, but it is as effective virtually as it is in person. And the statistic that I found was discussing cognitive behavioral therapy. So, you know, please don't quote me if there's other modalities that aren't as effective or that are even more effective. But when we talk about CBT, yes. Yeah.
Awesome. Thanks for that last answer there. Thank you for a
Yeah.
great presentation. I know we've got a couple comments in the chat as well, thanking you for your time and your presentation. For all of our attendees, thank you for attending.
Yes.
I'm going to drop in the chat here our link to the CEU evaluation survey. Remember, you do need to fill out this survey if you want CEUs for this presentation. This link will also be emailed to you just after this meeting is over. So no worries. You know, if you happen to be taking this from your, you know, from a parking lot somewhere, and you need to respond later, you'll have that in your email to respond to, and those CEUs will be distributed by the end of the month. Again, don't forget to check out the information and registration information for our upcoming conference on June 4th. We would love to see you all there in both the educational sessions and in the exhibit hall. If you have any questions about that or anything else, you can always contact us directly at naipa@corpevent.com. That's all we've got for you today. Unless, Doug, you have a bit of a farewell that you'd like to hop in with for everybody.
Thank you, everyone, especially Jay. We really appreciate your time and involvement and sharing.
I'm so glad that you guys had me. This has been a blast. I really appreciate it, and look forward to any more in the future. Thank you all for participating.